Deborah is also from Edith Cowan University, and today she will be presenting to us on what are they going to do anyway. What should our response be to general practitioners' perceptions of speech pathology with Aboriginal adults with acquired communication disorders? Thank you, Deborah.
Okay. Right, so very briefly, I'm not going to spend long on this slide, but just to point out the sheer huge size of WA and the very low numbers of Aboriginal GPs that we have in Australia. So in the context, as Beth was saying, of quite sort of difficult stats around life expectancy, morbidity, comorbidities and so on. So in 2014 there were only 204 Aboriginal doctors in Australia and 300 in training, but it means essentially we still have very small numbers of Aboriginal GPs. The context again, high levels of stroke incidence in Aboriginal people, stroke at a younger age, very high TBI incidence, particularly in relation to assault. And we know 30% of people approximately post-stroke have some kind of acquired communication disorder, that equally high levels of cognitive communication disorder after TBI. And also down here that Aboriginal stroke patients are less likely perhaps to be seen by allied health. That was, I've got the references down at the end. And are less likely to engage in rehab services. And then in relation to GPs, that they are still, really important, that they are a key point of contact for people once they return into the community after being in the health system. The GPs are gatekeepers to other services and have a really important role in managing a range of chronic conditions and comorbidities, and they're recognised as a very important part of the Close the Gap initiative put through the government. So for this very quick presentation on a very large topic, we're going to just look at how Western Australian general practitioners view speech pathology services in relation to Aboriginal patients who've got acquired communication disorders. And then just for this forum, I'm just going to also try and get you to consider how speech pathologists might respond to these attitudes, the situation. And that this work is part of the Missing Voices study that Beth mentioned that ran between 2013 and 2016. This is a qualitative component to that study, based on 23 interviews with general practitioners from Perth and around the state. And again, we analysed the data using Brown and Clark's thematic analysis. There was peer checking, and again, it has ethical approval. So very briefly, we talked to 11 male and 12 female GPs, been working for a range of years at a range of intensities with Aboriginal people, some working in Aboriginal medical centres, services, and others not, so some variation. Caseload, Aboriginal caseload being between 15 and 100%. Also worth pointing out here, although I don't have any great sort of insights into it necessarily, but 9 out of the 23 people we spoke to had English as a second language. Some will have trained overseas, so the amount of perhaps exposure to Aboriginal culture in their training may have varied. These are the themes across the interviews as a whole. I'm not going to talk about all of these today, there isn't time. I'm just going to focus on these two streams which relate to speech pathology, but also the GP's attitudes to acquired communication disorder. And we'll look through those in a little detail. And I'm going to use quotes for the bulk of this presentation because I think they say it rather than me. So essentially the first issue was that general practitioners felt that acquired communication disorder was something that they didn't see very much in relation, generally, but also in relation to Aboriginal people. I can't think of anywhere they've turned up with a speech problem as their presenting problem. So that was a very typical kind of response. Like if it's quite significant, then we come to know, but if it's borderline, maybe we're missing them. Now that's of interest because of course we know that as people go into the community with more mild communication, acquired communication issues, it suggests then that the GP is not going to be picking up on that. We pick it up when there's an obvious issue, it's stuck under the radar. Okay. In relation to high levels of comorbidities, complex medical and social issues, that was again, a very sort of strongly recurring theme. So this GP, that they will have comorbidities, and they've mostly got everything else wrong as well. Mostly have diabetes and heart problems and renal problems as well. So the GPs feel sort of overwhelmed by everything else. Mostly as a GP, you're faced with a presenting complaint, and the aphasia or dysphasia is actually a secondary thing. You just treat the problem as they've come with, unless they bring it up as a problem. I guess it's missed opportunities. So they're really not seeing acquired communication disorders within their caseloads as being particularly prominent. This was a smaller theme, but I thought it was important to report, and it will have an impact on the way GPs work with people. So there was a sense of fatalism, and perhaps this low prioritisation of people's health and ACD within that. And this quote is particularly interesting. This GP says, "I think also often it's people's aspirations aren't very high. I think this concept of being highly coherent is an aspiration of the well-educated, and it's not an aspiration of people who aren't well-educated and don't have high aspirations for their lives. And so being highly articulate, like they don't even aspire to that. They just aspire to be able to get what they're saying, just basic communication." So there's quite a substantial unconscious bias, or possibly conscious bias, not sure in that. It's very interesting. And so I'm not really sure if a lot of them even see it, Aboriginal people, even see it, ACD here, as a problem. There's all that non-verbal communication that people do, that maybe they're managing through some of that, and maybe they haven't lost that. So I don't get people saying, "I really need some help with my speech." Oh dear, 5 minutes. Then the issue of low literacy came up. So the assumptions on that particular stream of themes suggests that these attitudes perpetuate disadvantage. There's low prioritisation, despite evidence that communication disabilities lead to greater isolation, low mood and medically adverse events. There's an assumption that Aboriginal people are poor communicators, othering language, unconscious bias, and the potential perhaps that people are then offered less information. There's perhaps fewer educational opportunities for Aboriginal patients. Then in the last stream, this is particularly something I want speech pathologists to think about. GPs have real difficulty untangling acquired communication disorder from Aboriginal English, from cultural different ways of talking, and that was very significant. So what I've noticed is they also seem to struggle with English, struggle with communicating. They certainly don't communicate like we do in English. And we have a number of these kinds of quotes where, again, untangling the aphasia and everything else is very difficult. Sometimes we get patients don't really talk to us at all at the best of times, so differentiating that between an expressive and receptive dysphagia or something like that makes it a bit tricky. Very limited knowledge of acquired communication disorders, thought it was an issue with their training, recognised that if they don't recognise it themselves, their referrals may not then be appropriate. And here, I suppose there's also the sense of what actually can you do to improve this person's speech? I suppose we're just ignorant. Very few referrals to speech pathology. Low knowledge about speech pathology, this is important for us, and we are seen as inaccessible and limited by a lot of GPs. I certainly refer to physio much more frequently than speech. I honestly didn't think it was available. Are you going to say, no, you need to see a speech therapist because this is going to make such a difference to your life? And it's like, well, actually, it's probably not. So let's concentrate on the diabetes. Okay? So, anyway, wonderful, jolly quotes that I will tell you more about at a time. And then, sorry? Oh, sorry. Usually those allied health people make follow-up appointments. You assume it's already been done. That issue came up a lot. Okay. So then in terms of the GP's attitudes to actually managing acquired communication disorders, they depend a lot then on family members, on Aboriginal health workers where they have access to it, but very, very rarely use interpreting services. So the quote for this talk came from this one, and you think, you know what, it's not worth it on a number of factors. This is in relation to referring to speech pathology within allied health. And what are they going to do anyway? They might do this, but then they're not going to be able to see them for 2 months, so, you know, what's the point? So, again, the implications of these attitudes are that we are going to be missing ACD. GPs are not going to be referring to us in relation to ACD. And involving family and Aboriginal health workers is very important, but they seem to be passing the problem over rather than actually understanding what they might do about it in relation to our services. Just to finalise this talk, putting this into context from some of the work we've done, surveys that we've done, speech pathologists themselves appear to have quite low confidence in relation to working with Aboriginal adults with acquired communication disorders. They feel they lack assessments and treatments, this is exactly the point from over here, that they recognise they may not see many Aboriginal patients and therefore feel that they don't have an opportunity to upskill. That they prioritise working with children and so on. So all of these issues have come up in surveys. So what are we going to do anyway? Yes, we have a desire to work well. The work that Beth has been leading at Edith Cowan means that we do now have some culturally appropriate assessments. We do have some work going on to develop culturally appropriate treatments. But in terms of GPs, I think we have a lot of work to actually, you know, explain what we do and explain what kinds of issues are going to arise for patients who have acquired communication disorders. So for questions, I was just curious, how do you think we're going to cope if our referrals increase? Are we valuable, accessible, and effective in the eyes of GPs, and if not, why not? And can we tailor our services effectively? Okay. Conclusions. Thank you.
That's 2 questions.
I'm just wondering, I'm not sure if you included it, but what follow-up was there, if there was any for these GPs?
Do you mean going back to them with the results, yes?
Yeah, like education and, you know.
Oh, that's a big job. Well, I'm in the process of trying to...
funding anytime.
This was part of Missing Voices, and we wanted to know how what people's experiences were from a range of different perspectives. So this was our attempt to find out how GPs, as key gatekeepers to services, see issues for this group of people. I'm in the process of finalising writing this up. I'm hoping that it will be published next year. That will be with the team on behalf of the team. And in terms of follow-up, yeah, I mean, I think that it's a question of raising awareness and as this work is published and as an evidence base emerges around how Aboriginal people experience acquired communication disorder and what services they actually need, then we can go back in and offer training and awareness raising for general practitioners. There are some very good training programs already available for them around Aboriginal health, but I think acquired communication disorders have not been part of that, and I don't really think this rests on the base, I think, of a very poor knowledge of speech pathology per se, that GPs don't actually really know what we do for adults post-stroke and TBI. So I think that's the issue. Yeah.
Just one more question.
Sorry. Thank you for your talk. From a broader perspective, I'm working together with some others on an advocacy project with Speech Pathology Australia to improve the referral process through GPs. So we're brainstorming at the moment. We've put together a package and we're brainstorming what is actually the best and digestible way for GPs to, I guess, access that, and how we're going to actually get that uptake and how we're going to distribute that. So I sort of wondered whether you had any ideas about that or knowledge. It's something we've been struggling with.
We need to, I think we need to keep talking with general practice, and we need to raise our profile, and particularly now, we have an expanding evidence base. We have a wonderful research base in this country around acquired communication disorders, and we need to be getting into discussion, with GPs at a very basic level, and they know what physios do. It was really interesting from this research. GPs really value physios, but they assume everything that we do is done at the time of inpatient rehab, and that we stop. And probably their perception is that we've stopped because actually our services are not well funded for adults anyway, so they're not seeing us as a prominent part of the allied health team down the track at community level with people with ongoing chronic acquired communication disorder. So yeah, we need to just keep working away at that.
Our last presentation